to introduce you to new ways of partnership working in collaboration with all partners involved in delivery of healthcare, particularly for people living with respiratory conditions or lung conditions, in simple terms. Now, why did we choose to focus on the lungs? Historically, Barrow-in-Furness has been a deprived town with lots of social deprivation that has led to increased smoking and associated lung-related illnesses. We developed this new approach based on your feedback. Now, as a GP, I see people after discharge, and numerous times they have given us these two comments. One, that they had to wait several hours in accidents and emergency before they could see an expert. Number two, when they are discharged home, they don't know what's happening in the community, they don't have a dedicated follow-up, they are sent home, or when they are discharged home, they don't have adequate information in the form of self-help, what they can and can't do to improve their health at home or to manage their condition at home.
I'm Paul Grout, I'm a consultant in emergency medicine, and I'm also the Deputy Medical Director for the Trust based at FGH. Well, what we're looking at is ways of actually improving patient care. That falls into a number of things. It's to do with preventing patients actually being admitted to hospital in the first place. If they have been admitted, getting them out more quickly, and also trying to prevent relapses or severe relapses of their condition so that they don't actually need so much significant medical input.
In terms of patient, I mean, no one wants to be in the hospital, and I think if you speak to most of our patients, that's the last place that they want to be. Everyone understands there's a need sometimes for patients to be in there, but actually caring in your own home is a much better place to be. It's important from an NHS point of view because obviously there are cost implications with any hospital stay, but also when a patient's in hospital, they can also be at risk of picking up other illnesses that are around. And sometimes getting them out of hospital can be quite difficult because when they go in, sometimes care organisations pull out for a little bit. Getting that reinstigated often means to extended lengths of stay, whereas if we get them out quickly, the care organisations are still going in, and it means that there's no kind of disruption to their ongoing care packages.
Okay, so I'm Timothy Gatherell, I'm a consultant respiratory physician here at University Hospitals of Morecambe Bay. Been here for the last 2 years. And our main area of interest at the moment is a new project regarding early discharge for patients with COPD who've been admitted to hospital. So COPD is a very common condition, and particularly in winter time when we've got the normal winter chest viruses around, people who have damaged lungs, which is what COPD is essentially, are much more likely to come into hospital, but they may not always need to have an extended stay in hospital, and much of the good high quality treatment can be provided at home when you have the right community care. So it's about identifying those patients. I think everyone will appreciate that the NHS is under extreme pressure, and the winter time really brings this to the fore.
What we need to look at here is, yes, the process frees up some of the time in the hospital, but the whole project is not done to release capacity from the hospital. The whole process and the project is developed to deliver highest quality of care, which is seamless for the patient involved. So our prime focus is you as an individual, so everything revolves around you. What that does is, if we manage your condition effectively, then you are staying in the hospital shorter, so you automatically release capacity from the hospital. As a part of this project, our aim is to deliver the highest quality care for people living with lung condition. That's not only that, but during the process you receive a 5-star journey from the time you are admitted to the hospital to the time you are discharged back into the community to live independently. We would love your feedback on how the process is going, and tell us if there is anything we can improve to ensure we deliver on both of our aims, to deliver a high quality service which is of the best experience.